Okay, let's unpack this. You can tap a screen right now, and a hot pizza or like a ride across town arrives in, what, 15 minutes?
Right. Yeah, exactly.
And the app knows exactly who you are, where you are, what you need. But, you call your doctor's office and suddenly you're trapped in this like 1990s time warp.
Oh, absolutely. You're spelling your name for the third time,
Yes.
repeating your date of birth, your SSN.
Just hoping you don't get transferred to a deadline.
Right, which happens all the time.
Yeah. So for today's deep dive, we're looking at a recent interview with a senior CX and AI consultant.
Mm-hmm.
And this person spent 12 years managing hospital contact centers.
A lot of experience there.
Yeah. And our mission today is to figure out why healthcare customer service is just decades behind retail, and more importantly, how hospitals can actually, dig themselves out of that hole.
It's a big hole.
It really is.
Yeah.
I mean, if I call my TV warranty company, their automated system knows my model number and my problem before a human even picks up. So why does healthcare struggle with basic caller ID?
Well, it basically comes down to fundamentally fragmented data. I mean, in retail, your profile is centralized, right?
Okay.
But in healthcare, patient data lives in these heavily siloed EHR systems. And often, it's multiple different systems within the exact same hospital network.
And they just don't talk to each other.
No, they simply do not talk to each other. So every single time a call moves from scheduling to billing to, a specialist.
Kind of start over.
Exactly. The identity verification process has to start from scratch every time.
Which, I mean, that isn't just frustrating for the patient. It's incredibly expensive.
Oh, hugely expensive. What's fascinating here is how the consultant noted this friction creates this severe domino effect.
Why?
Patients get fed up and they just abandon the call, right? And then they go book with a quick one-stop digital clinic instead.
Because it's easier?
Because it's easier, meaning the hospital loses that immediate appointment revenue.
Wow. And I imagine that impacts the staff, too.
Right. Oh, big time. On the operational side, a telecom costs spike because patients are calling back 3 or 4 times just trying to reach the right department.
Just to get someone on the line.
Right. And the staff are fielding those redundant calls,
Yeah.
which forces them to create these messy manual workarounds just to process the sheer volume.
Which has to lead to burnout.
It directly drives staff burnout and turnover. It's a huge issue.
Okay, I hear the structural problems, but hospitals are massive entities.
Yeah.
They have millions in funding.
Right.
Why can't they just, buy an off-the-shelf enterprise AI system like an airline does and just brute force the problem?
Well, because AI is an amplifier, not a fixer.
Okay.
If you drop an AI into a hospital network, it tries to learn from the existing processes.
Right, which are broken.
Exactly.
Yeah.
And in healthcare, those processes are heavily reliant on what the consultant calls tribal knowledge.
Tribal knowledge. Meaning the official manual says one thing, but the staff actually does something completely different.
Right. Yes, exactly. I mean, standardized data is what AI actually needs to function. But hospital staff are relying on, sticky notes on their monitors or
literal sticky notes.
literal sticky notes.
Yeah.
Or whispered workarounds to bypass a legacy billing system or, a shared spreadsheet that one single nurse updates manually.
Oh, wow.
So if an AI system learns from chaotic, undocumented workarounds, it just automates that chaos at scale.
Here's where it gets really interesting to me. It's like upgrading a regional transit system to a high-speed bullet train, but leaving it on crooked wooden tracks.
That is a great analogy.
Yeah, the speed doesn't fix the commute. It just guarantees a derailment much faster.
That is exactly the danger. And you add in the reality that clinical, administrative, and IT departments, they often have fiercely competing budgets.
Right, so they're fighting each other.
Exactly. So you get gridlock. The source emphasizes that you can't just mandate an AI rollout from the top down and expect it to fix this.
So you need to involve the actual people doing the work.
Precisely. You have to build culture first through frontline champions. The clinical and administrative users who actually navigate those sticky notes and spreadsheets every day.
The ones who actually know how the system works.
Right. They have to be the ones who guide and design the new standardized process.
Okay, so if a hospital actually takes the time to straighten the tracks and standardize those workflows, what does the payoff look like? Because we aren't just talking about selling more shoes here, right?
Right, no.
We're talking about patient health.
Exactly. And if we connect this to the bigger picture, the ultimate goal here is better medical outcomes.
Right.
The consultant shared a really cool scenario where the technology runs quietly in the background. So imagine an agent is on a call with a patient, scheduling a follow-up.
Okay.
While they talk, an AI is analyzing the patient's centralized record, and it just gently prompts the agent on their screen.
Little pop-up.
Yeah, noting that the patient is also due for their annual exam.
Oh, wow. So the agent doesn't have to manually dig through 5 different tabs in the EHR system to notice a gap in care.
Right, they don't have to hunt for it. They just see the prompt and offer to book it right then and there.
That's amazing.
It seamlessly closes a vital care gap. I mean, the agent's cognitive load is reduced, and the patient feels like the hospital actually knows their health history.
Which makes preventative care rates go up.
Exactly.
So what does this all mean for, say, an operational leader at a hospital right now? They're staring at a massive backlog, tired staff. How do they actually initiate this without totally paralyzing the organization?
The main advice is don't boil the ocean. You need to pick a single, measurable bottleneck.
Like what?
Maybe it's solely focusing on reducing your internal transfer rates, or maybe just cutting down the number of abandoned calls on Monday mornings.
Just one specific thing.
Right, just overhaul that one specific workflow first. Clean the data, remove the tribal knowledge, and test your new process there before you try to revolutionize the entire hospital network.
So fix the wooden tracks in one station first. I like that.
Exactly.
But, there's a final thought from the source that really stuck with me.
Oh, yeah?
Yeah, they point out that a bad front desk experience creates a negative preconceived notion about the clinical care itself.
That makes sense.
Right. Like if a simple phone mistransfer or a rude scheduling loop completely erodes a patient's trust before they even step foot in the building.
Right, before they even see a doctor.
Exactly. How might that subtle frustration impact their willingness to actually follow a doctor's critical medical advice later on?
That is a profound point.
It really makes you wonder if the healing process actually begins the moment they pick up the phone.